Gynecomastia surgery can be performed in two ways. My primary method is to make an incision along the border of the areola and the breast skin. I use this incision because it hides very, very well with any color of skin, dark skinned or light skinned. The color difference between the areolar skin and the breast skin allows that scar to fade very nicely. I will perform liposuction of the breasts initially because there's always fat associated, and then uh, breast tissue can't be liposuction. So after I'm done with the liposuction of the fat, it makes the breast tissue very well defined. And in this case, the breast tissue is lifted off of the deep side of the nipple areola complex and removed from the breast. Occasionally have to put some sutures in to make sure the contour is perfect. And then the incisions are closed with buried sutures covered with surgical glue. I do not use drains for this procedure.